This hearing of the Committee of the Judiciary Subcommittee on Commercial and Administrative Law will now come to order. Without objection, the Chair will be authorized to declare a recess of the hearing. I will now recognize myself for a short statement. 2 years ago, this subcommittee held a hearing on a Harvard study which examined 2001 bankruptcy filing data in 5 select judicial districts around the country. That study concluded that illness or high medical bills contributed almost half of all the bankruptcy filings that were studied. Today we revisit the issue of medical debt as a contributor to bankruptcy. The authors of the study have now released an updated version, published online last month in the American Journal of Medicine, based on 2007 data of bankruptcy filings nationwide. Disturbingly, this study concludes that 62% of bankruptcy debtors can trace at least part of the cause of their bankruptcies to medical debt. The 2007 data also indicate that there was nearly a 50% increase in medical bankruptcies as a proportion of bankruptcy filings between 2001 and 2007. The updated study further suggests that medical debt is driving middle-class families into bankruptcy. Of those classified in the study as medically bankrupt, more than 60% attended college, more than 66% at one point owned a home, and 78% had health insurance at the time they became sick or injured. Accordingly, it's obvious that medical bankruptcies are not the fault of people keeping track of their assets and liabilities. They are the victims of life's lottery. Ultimately, the problem lies with the runaway cost of health care in America. It's simply too expensive for millions of Americans to buy any health insurance at all. And even for those who have insurance, excessive premiums and deductibles, low coverage caps, and uninsured medical conditions are just some of the reasons why Americans with health insurance are left one serious illness away from financial disaster. And when that financial disaster may hit, it hits hard. Studies show that many are skipping recommended treatments, not filling critical prescriptions, pharmacists postponing doctor appointments, and cutting back on other essentials like food in order to stay financially aloft. Often the debt becomes so burdensome that Americans are faced with no other choice but bankruptcy. Medical bankruptcies have a collateral effect on creditors, because when you have a medical bankruptcy, all creditors lose, which means small business loses, which is an important reason why small business and creditors in general benefit from a health care system that doesn't drive American citizens into bankruptcy, where we lose the opportunity to collect on lawfully owed debts. It is my sincere hope that today's hearing will help us better understand the extremely serious consequences of medical debt and serve to galvanize us to work toward finding solutions. I welcome ideas for amending the bankruptcy code to help provide needed relief for the medically bankrupt. I am certainly open to revisiting some of the more onerous provisions of the 2005 Bankruptcy Abuse Prevention and Consumer Protection Act, and in particular the means test and the credit counseling requirement. Credit counseling certainly can't help a person who has gone into bankruptcy because they have a major medical problem. That is something that maybe a checkup with a doctor could do more good, and the credit counseling becomes a waste of time. Perhaps this could achieve a better balance between creditors' rights and the need for relief for honest medical debtors. In addition to exploring bankruptcy law changes, I believe the long-term solution to runaway health care costs is to enact meaningful health care reform. It would be remiss if I did not recognize the leadership of the distinguished chairman of this committee, the Honorable John Conyers. He has drawn attention to this important issue over the years, and I applaud him for his efforts to bring about legislative change in the medical field and for universal coverage. The updated Harvard study should be a useful reminder as to why Congress must consider refining the bankruptcy code and reforming our health care system to provide much-needed relief to those with overwhelming medical debt. Not to do so would be a crime. I thank the witnesses for appearing today, and I look forward to their testimony. I now recognize